Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, everybody wants to know about home health care. It's a very important issue today. And when I became a gerontologist 25 years ago, people said, well, what is that all going to be? And I don't want to go to a nursing home, and I don't want to get insurance because they're going to send me to a nursing home. And there's a lot of big things have happened over the years now, Chris, and you know it. So Chris MASTORIDIS is the Director, Marketing at Trilogy Home Healthcare, and we welcome you to the show.
Thank you very much. I'm glad to be here.
Yeah, and I know when I met you, you were so enthusiastic because you've been in this field for quite a while.
Yeah, I started, I guess, back in 1990. It seems like a long time ago now.
When people said, "What is that?" Right?
And it's the type of industry that changes, evolves year to year. Month to month. Lately, it seems like month to month, and that's so. I've enjoyed it, and I think that's one of the things I like is the challenge and looking for ways and opportunities to make people to find a way to be more independent at the time when they need us most.
Yeah, and to have good caregiving.
Correct. Yeah.
Care receiving, I would say. The caregiving, of course, that's what your company does, but then it's the care receiving of the people you're dealing with.
Yes.
So the big thing, though, I'm not laughing, I'm thinking about what you said back in 1990, and the whole point of that was that there were families around, and mom was taking care of grandma, and everybody was around to do something. Mm-hmm. But that has not kept the way it is. Now we have strangers, taking care of people, and it's all the way that people are trained and how they react to the very consumer. And do you do a lot of training on that?
Well, all of the individuals that we that work for Trilogy Home Care, they all come licensed, certified, and trained in whatever area of specialty they have. Whether we have caregivers who are CNAs, home health aides, but then we have skilled professionals like PTs, occupational therapists, speech therapists, RNs, LPNs. We even have respiratory therapists and social workers that work for us. One of the things that differentiates us is that we utilize respiratory therapists and social workers, where some of our other competitors don't use those services in the home.
Well, the one reason I wanted to be very clear that Trilogy Home Healthcare is very different because you're a Medicare organization, and
correct.
Medicare organizations, that's not when you go in, you look at a home health agency. Most of them are not. So maybe you ought to really give the difference.
Yeah. So with us specifically, we service the population that is Medicare Part A, not the managed Medicare that falls under the Humanas and some of the other plans. And we feel that does two things. It allows us to provide not only better level of service, but also we have to follow some very stringent guidelines. We're accredited, and we've gone through the process of being going through the accreditation process where they look at what are your outcomes with your patients, what are your length of stays. With Medicare specifically, most episodes of service are about a 60-day period, and then you have to get authorization and be able to document and show that there's a skilled need to continue services beyond that. So that's what differentiates us from some of the licensed agencies. Some of the other agencies, have the ability to work under insurance and other things. They can provide some of the same services, but they don't always provide all of the disciplines and skilled services that we can provide.
That's well said,
Mm-hmm.
because it could be a little confusing, but I'm glad that you explained that. And Trilogy Home Healthcare is a national company. Well, you have a lot. You have a lot of companies.
We're not national.
No.
We're right now we're just in the state of Florida. We're in all but 2 counties in Florida.
I guess that's what I meant, because
Yes.
I knew you were all throughout Florida.
We hope maybe one day
Right.
to expand to national, but right now Florida is where our focus is, and the only 2 counties we don't service right now are Miami-Dade and Orange County.
And you specialize in Broward.
Yes,
Broward County.
that's my territory.
Right. So if someone's
Yeah.
going to call and we're going to give them that number, then you're going to definitely be able to take care of them. So in Broward County, if you want to talk to Chris, you're going to call 954-689-6660. That's 954-689-6660. And of course, you have an associate, Cindy, who is up in
Palm Beach
County.
Yep.
So it just depends where you live. That's the way it's going to work. Okay, well let's continue with this. So, do you notice that a lot of females have come into this business? I love to see a male. How did this all start in your life? Why did you have a mother you were very close to, or you saw things? A lot of sisters?
You know what? I got into home health originally with a recruiting company where I was recruiting physical, occupational, and speech therapists to provide to other home care agencies in the New York area. And subsequent to that, I'm the type of person that I always like to go to the next level. So I learned as much as I could about that. Then they gave me an opportunity to be an interim administrator for one of the home care agencies in Brooklyn that they ran at that time. And so I dove right in, learned all the regulations and everything that you needed to know to run an agency. And so then from there it evolved into running individual agencies in that in the New York area. And then in a consulting gig where I did it nationally for I think I was in 17 states with a lot of franchisees for a healthcare company. So it evolved over the course of time. You know, I've subsequently moved back to Florida, my home state, and felt that, you know, it was the right time at this stage to transition back to Florida. But I think I've taken everything I've learned nationally and tried to apply it in the short period of time, you know, the 4 or 5 months that I've been back here. Healthcare is not that much different, and there's a large population down here that needs the assistance. So it's been fun, and it's a new challenge, you know, trying to learn all of the hospitals and the assisted living facilities and everything, and the doctors in the area. It's a great opportunity.
Yeah, you're right. I mean, this is the place to be in South
Yes.
Florida, isn't it? I mean, and having a, but we want you to have a good company. That's what's important for everybody, to have good companies. And I know that Trilogy certainly has passed that test. So, so why would someone call you? Let's give an example. Someone's sitting listening to this show and they have a problem. Give us some interesting little samples of why.
Well, most of our we work with a lot of patients with a lot of different needs, right? Anything from orthopedic needs after they've just come out of the hospital for a total knee or total hip replacement. We work with individuals who have COPD or are congestive heart failure. We also can go in and do. We have one of the largest psych-based nursing programs. And a lot of people look at that and say, well, I don't really have any psych issues. But psych nursing is really not about, you know, the schizophrenics and those. It's about assessing individuals who have early signs of dementia. It's about assessing people who have depression, anxiety. A lot of people misdiagnose and say, oh, well, we're taking care of Mrs. Jones because she broke her hip when she was walking to the bathroom. Well, she was walking to the bathroom anxiously because she was in a hurry to get to the bathroom. She was using her walker and not really paying attention because she was rushing, so she tripped over a scatter rug with it, fell down, broke her hip. A lot of people will go in and they'll assess and say, oh, we're treating her for a broken hip. We've got PT, we've got nursing in there for the wound. But what about the fact that she gets anxious when she worries about, can I make it, because I can't walk as fast as I used to, can I make it to the bathroom? They don't think about that side of it. That's where the nurse can go in, do the wound care, but if they have that psych-educated background, they can start talking to the patient about methods to decrease anxiety, to make it less stressful for them when they know they have to make it from one room to another, or they get anxious when they have to sometimes transfer and do the steps to their front yard because they're going out to dinner with family and that, and they're running a little bit late. So these are things that we take for granted. And when people hear we do psych-based nursing, they don't really translate that. I'll have another perfect example where we had someone who was living in an assisted living facility, and they were having trouble with incontinence. And the issue was that they thought that they were becoming less dependent and that they would have to move out of the assisted living community. When we sent in one of the nurses to assess and see what was going on, we found out through the testing that she had early stage dementia. What happens with early stage dementia, sometimes they go into the bathroom and the white coloring of the toilet, they can't identify where the toilet is. And that dementia was causing the issue. Once they changed the color of the toilet lid, it made her able to identify where she needed to go, and the problem, subsided. So she was able to stay in that community for another 6 months.
I'm very impressed with the things that you're saying. They're really important, but it takes a real education to know what you know. And, unfortunately, a lot of people wind up in people's homes and they don't really have this kind of education. And as much as they're kind and nice, that's not good enough. Right. And so it's wonderful that you have that. And then when you hire people, I'm sure you have a training that helps everybody.
Yeah, we have a very stringent. When I came, when I relocated, I'd been looking for an organization to start working with here. I was with a very reputable organization up there for the last 5 years, and I looked for a similar type of organization. And the reason I selected Trilogy was because of what I found online, the people I interviewed with, and the ethics. Prior to them being with Trilogy, they have a track record from previous organizations that I know. And I go back to the 2 counties we're not in. Why are we not in those 2 counties? There's lots of business in Miami-Dade. There's lots of business in Orange. But in those 2 counties, those are the 2 highest counties for fraud in the state of Florida. So with a moratorium on Medicare licenses out there, you can only acquire other agencies. You can't open a brand new one. And our owner is so steadfast in his ethics, he will not acquire somebody who has a blemish on their record.
Good for him.
So
Good for
he's waiting it out
Right.
in those 2 counties. That tells me a lot about the organization I work for. So.
Yeah, I remember when we first talked, you were saying that before you took this position, you did talk to people who work for Trilogy and
Yes.
And what some of the comments were. So that's really wonderful, and I'm glad they found you because you need to have good managers. I mean, I don't care how good a company is because you're the one on the cutting. You're on the line. You're in the trenches, and you need to know what's going on. So now, if people and you do take long-term health care insurance, I'm sure.
We do not, but we work with a lot of partners.
Oh, so the people you refer to, that's right.
Yes.
When you're do what you do, and then they have to go to a long term.
And we've partnered, not in a financial sense, but in a strategic, looking out for what's best for the patient. We've partnered with a lot of agencies that take the insurances that we don't take, that do the private pay that we don't do, and that do the long-term care. So we know from those 2 or 3 agencies that we work with, we're handing the patient off to somebody else who's going to treat them the same way we would.
Yeah, that's wonderful. Well, it's just great talking to you, Chris, and thank you for coming by. This is Trilogy, and this is the Home Health Care, and the phone number again to reach Chris. Their office is in Coral Springs. It's 954-689-6660. 954-689-6660. Thank you so much, Chris. We'll see you at the expo.
You got it.